Okay, now are you able to see Dr. Prajakta?
Yeah.
Okay. Okay, let me know whenever you are ready and I'll start the timer. Are you ready, doctor?
Just yeah. Okay.
Okay. You may begin now.
Hello, I am Prajakta, one of the doctor here in GP clinic. Uh, can you confirm your name and age for me, please?
Yeah, doctor, I'm Singh and I'm 35 years old.
Hello, Mr. Singh. How can I help you today?
Well, doctor, I've been feeling a bit tired and I have came here for a follow-up because I had some blood tests few weeks ago.
Uh-huh. Okay. Mr. Singh, like as you mentioned, you came here 6 weeks back, right?
Yeah.
So, just can you give me a quick recap, like what happened?
Doctor, I was feeling tired for a period of nearly, it's been 4 or 5 months. So
Oh,
I
I'm
came
so
in.
sorry.
Yeah, so I came into the GP to get some blood tests done.
Uh-huh. I'm sorry to hear that. It must be quite difficult for you for as you are feeling tired for such a long time.
Yes, doctor, it is. It is.
Yeah. So, can you tell me, like, what do you have other than this tiredness? Do you have any other complaints?
Like what, doctor?
Like, have you noticed that you are going to loo more often these days?
No,
Okay. Do you have any heart racing or dizziness?
no,
Okay. And do you have any fever or flu-like symptoms?
no, doctor, nothing like that.
Before 3, 4, 5 months, how was your health?
It was all right. I was doing fine.
Uh-huh. So, like as you said, it's for 4 to 5 months. So, have you given a thought what can be the reason for your tiredness?
Well, doctor, I did give a thought on this, but really I couldn't understand like what's going on. I read a few articles on the internet, but I don't know what's going on. But
Uh-huh.
are my blood results back?
Yeah, I'll talk to you about that. Give me just bear with me. I'll be asking you a few more questions. All right?
Okay, okay.
Yeah, okay. So, by any chance, do you have any muscle cramps or like problem related to your sleep?
No, I'm sleeping well and no muscle cramps.
Okay. And any lumps and bumps in your body?
No,
Okay. Or any, how's your appetite these days?
I'm eating okay. I'm like not that good, but yeah, I'm managing well.
Okay, right. So, have you been diagnosed with any medical conditions in the past?
No, no,
Are you on any medications, any over-the-counter drugs?
no.
All right. And just few questions related to your personal life because it can also have effect or they can be the reasons for tiredness. Is that
Okay.
okay?
Yeah, sure.
So, do you smoke, Mr. Singh?
Uh, Sometimes, yes.
And okay. And do you drink alcohol?
No, no, doctor, I don't drink alcohol.
How's your how's your diet?
That I told you, doctor, it's manageable. It's fine. Like I
You
try
eat
to eat
healthy
healthy.
diet.
Yeah, I try to eat
Oh,
healthy.
that's good. That's good. And are you physically active?
Well, due to tiredness, I'm not able to do much of the exercises because I feel
Yes.
tired.
And what do you do for living?
I work as an accountant.
Okay, right. So your tiredness is affecting by any way to your work?
Yeah, it is because not able to concentrate on my work properly because of this tiredness.
Okay, yeah, right, right. So, Mr. Singh, like I would like to examine you. I'll be doing your observations and general physical examination.
Mm-hmm. Okay, all right.
Yeah. So, Mr. Singh, as you mentioned that you came 6 weeks back, right, for your
Yeah.
blood test,
Yes.
but unfortunately, our system has crashed, and I don't have your reports at this moment. I'm so
Okay.
sorry to say that.
So what will you do now, doctor, for me?
So, what we can do now is, if you are ready, we can do your test again so that I'll be in a better position to help you. Would that be okay?
Okay. So I'll have to give my bloods again.
Yeah, this is one of the option. Or what we can do is, we will book your appointment again. We are working on our IT system, and we will book your appointment again when our IT system will be like if we can get back your reports.
Okay. Okay. That's fine.
So, so are you ready to wait until our IT system will work on that, or you are ready to give the blood sample again?
Okay. It's fine. I can give my blood samples. It's fine. Mm.
Yeah, thank you so much for considering our option. And I'm really very sorry that at this moment I was not of much help to you because I don't have your reports at this moment.
Okay. Okay.
Okay. So, and yeah, and in like in we make sure that our patient get the proper care, and we will make sure that next time it won't be happening and you will get the proper care at the correct time.
Yeah. Sure, doctor. Yeah. But
Do you have
what is the cause for my tiredness? I'm not able to understand that.
Yeah, that's a quite a valid concern from the examination and from the symptoms which you have told me. I'm not at this moment. I'm not able to tell you the exact cause. So what I can do is I will involve my seniors. They will be coming and examining you again, and we will be doing your blood test so that we will get the correct idea what the exact cause is. Would that be okay for you?
Yeah. Sure. Okay. Mhm.
Yeah. So
Okay.
what I will do now is we'll be taking your blood sample for the test, and our seniors will be coming and talking to you. They might examine you and they will guide you further. All
Okay.
right.
Okay. Okay. Okay.
Okay. Thank you so much, Mr. Singh.
Yeah. Thank you. Thank you. Thank you, doctor.
Thank you.
Okay. The time's up.
Yeah.
Okay. So, do you know what was the station about?
No.
Okay. Okay. Have you heard about chronic fatigue syndrome?
Yeah, actually, I thought, but they say no because chronic fatigue syndrome, you have to be confirmed that other causes are ruled out. Then we can say that it's a chronic fatigue syndrome. So I thought first we'll get the blood investigation. If everything normal, then we can say this is what I thought.
Yes, yes, you are right. You are absolutely right. But okay, let's begin. Start from the beginning where you started. You started very nicely, good, confirming the age and everything, and ruling out the differentials. You could have dived in a bit deeper about the tiredness, like when exactly it occurs, and are you able to carry out your daily activities, and any particular day you feel tired, or you know something like that, like a bit more about tiredness, when exactly it started, how it started, is it gradual, and does it stay every day, the whole day, or does it come in a particular time of the day? A bit more about tiredness history. You ruled out differentials quite well. You ruled out diabetes. You ruled out anemia. That's fine. Past medical history and Meftosa and DESA, that was fine. That was all right. Uh, what was the main thing was, in management you could have done a bit better. As you said that, you thought that after getting all the blood tests only we can rule out chronic fatigue syndrome. So but in exam, what we have to remember is, in exam you have 4 marks for management, so we cannot forget that 4 marks is for management, so we have to give some kind of management. Obviously we cannot be sure, we cannot diagnose diseases in 8 minutes, but what we can give is a provisional kind of diagnosis. What we can say is, in this way we can present our diagnosis. Like, from our assessment, your tiredness doesn't seem to have any medical cause. We will do some investigations to make sure everything is fine. If all investigations came back normal, then this condition is called chronic fatigue syndrome, which means long-term chronic tiredness without any medical cause. So in this way, we have to give a certain kind of diagnosis to the patient. Obviously, we cannot be sure that it is, but in this way, like I said, it could be chronic fatigue syndrome. In this way, we can say that. And then obviously, you have to tell the patient what all investigations would you be running, like anemia, for checking for anemia, vitamin levels, thyroid levels, and blood sugars as well. I hope you
Okay.
are. I hope you are getting what I'm trying to say.
Yeah, yeah.
Okay.
Oh, yeah. So, what is the significance of giving that IT system it crashed 1 week back? So I thought maybe we have to apologize for that. So,
Yeah, yeah, sure. We have to. You have to apologize for that, and you have to say that, okay, I'm really sorry, I don't have your records. And is it okay if we, if it's possible for you to take, give bloods, and we'll run again all those investigations. So yes,
okay.
it's just it's there, not much significant uh, with respect to the station, but yes. And also you have to reassure the patient, because it's a long term tiredness and all. So you have to say that, I know it's difficult for you to cope up, but long term doesn't mean we cannot do anything. There are several ways through which we can make you feel better. Like, in chronic fatigue syndrome, management is all about lifestyle. So we have to give an overview plan of management, like uh, lifestyle changes, diet, good sleep, and graded exercises. So we have to ask the patient to have well-balanced diet. We'll give vitamin supplements, try to have frequent rest. Also, we refer the patient to cognitive behavioral therapy, because in such conditions it's difficult to accept the diagnosis. So someone will talk to him about the problem, and it will help him accept the diagnosis and understand how our behavior can affect this condition. So this is also very important, CBT in chronic fatigue syndrome. Also, we advise the patient to do graded exercises therapy, where they start with low intensity and gradually increase their level of intensity. So this is the management which we give to the patient in case of chronic fatigue syndrome. Uh, also, I think in case of long term tiredness, when a patient says that he has been tired for quite a bit, few months, I would say that initially building the rapport is very important. Like, uh, just the moment after the patient says that he has been feeling tired for a few months, we can ask the patient, like, how are you coping and how is it affecting their daily lifestyle? Because obviously the patient is having tiredness for a long time, since such a few months. So obviously this sentence will help you build rapport with the patient. Also, it will help you increase your marks in IPS. So this is, I think, important. And also you did good by asking his idea about like, because it's going on for a while, so have you given some thought? That was a really nice question. So obviously this ice is really important in this way. Yeah. So do you have any questions? With I hope you are all of you are getting what I'm trying to say in chronic fatigue syndrome.
Uh, just I have a doubt. Like if you, like I said, I was not knowing the diagnosis, and I said that I'll discuss with my senior. So will they give any mark on that, or it will be like they won't give any marks on that?
Well, the way you said your management, I don't think so. They will, hardly they would give 1 or 2 marks, but not obviously like good marks, because in management you have to lay down a whole management plan for the patient. You have to give him a diagnosis, and you have to tell them what all investigations will you carry out, and what is the treatment plan. So management will include all these three things: giving the patient a diagnosis, telling them what all investigations you will be carrying out, and laying down a kind of management plan or the treatment plan for the patient. It could be anything like any medications, or it could be lifestyle changes as well. So I think at this point it's very important to tell this patient all these three things.
Thank you.
Hello, doctor. I have a question.
Yeah, sure.
Is not it was like a type of ethical station, as the reports are lost, as there was some IT problem. So I thought in start as it is like medical error. So it's seemed like that.
Yeah, it seems like medical error. Uh,
Okay.
but if you look at the question stem and see the task, what is expected from you, it says that take history and talk to him about further management.
Okay. Okay.
So yes, so in that way it becomes the medicine type of station.
Okay. If we take it as a medical error and we deal as a medical error, so will it cause some trouble?
No, I don't think so. It's medical error, because here doctor has not made any mistake. Neither any medical person has made any mistake. It's all about the computer system that is being crashed, or it's not working. So I don't think so. It's a medical error. Medical error is occurs at that time when a medical person has made any mistake. For example, while taking bloods, or while cannulating the patient, that the doctor has left the needle on the bedside. That's a medical error. And the biopsy sample is lost. That's a medical error. And made some gross mistake. Patient wasn't missed was not requiring some kind of medication, and the patient was prescribed certain medication. That's a medical error. So I think crashing of IT system is not a medical error. It's something, like it's the system is not working, you can say that. So I don't think so it's a
Yes.
error from the doctor's side. Yeah.
Okay. Thank you. Thank you, doctor.
Yeah. Yeah, it was a kind of distractor only. Yeah, you are right. So always I tell that, read the question very, very carefully, because always also read the last lines, what is required from you, because it will tell you what is your main task, what you have to do when you enter the cubicle. So in this question, it was said that take history and talk to him about further management. So obviously, your task is to take history and discussing the management options with him. Yeah, I'll share the screen again. Okay. 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 I hope you are able to see now. Okay, as you can see, you are F2 in GP clinic. Mr. Singh, 35 years old, presented to the GP surgery 6 weeks ago with tiredness. He has come for follow-up. IT system has crashed and his records are not available. Take history and talk to him about further management. So always remember, as you most of you got confused between medical error and mistook the station as medical error. As I said, medical error occurs when there is some kind of like I said, either the blood sample is missing, or some kind of negligence from the doctor's side or the medical staff side, or the nurse, they have made some kind of negligence. So in that case, it's a medical error station. Whereas in this case, as the IT system has crashed, so I don't think so. It's a kind of error from the medical side. It's just a system that has crashed. Always see the last lines, last two lines. What is your task? Like always, it will help you a lot in the exam. And obviously, in exam, you'll be very in so much stress. So focusing on your task, it's very important. Yeah. I hope it's clear now for you.
Yeah. Thank you, doctor.
Yeah, welcome. So, anyone else who would like to um join in for another mock, another station? Yes, doctor, you can turn off your mic, turn on your mic, and you can join in, doctor.
Hello,
Hello. Yeah, may I know your name, please?
I'm Jasmine Modi.
Yeah, hello, doctor. How are you?
Yeah, I'm fine.
Yeah. So let me share the screen, and you'll be able to see the station. Yes.
No issues.
Yeah.
You have a timer, right?
Yeah, I have the timer.
Mhm.
Okay. Are you able to see now?
Yes, I'm able to see.
Okay. Let me know whenever you are ready, and I'll start the timer.
Okay, just give me a second.
Yeah, sure.
You are applied to GP clinic. Mrs. Smith is calling you. She has some concerns. Okay, please go ahead with this. No problem. I'll try. Hello.
Hello.
Yeah, please go ahead with the timer.
Yeah, sure, sure. You can start now.
Jasmine Modi, GMC 7774501. Hello.
Hello.
Yeah, I'm calling from GP clinic. I'm just been one of the doctor working here. May I please confirm whether I'm talking with Mrs. Smith?
Yes, doctor. I'm Mrs. Smith.
Okay, Mrs. Smith, could you please confirm your full name for me and age for me?
Yeah, I'm Mrs. Smith, and my age is 40 years old.
Okay, Mrs. Smith, is this the right time to talk with you?
Yeah, sure, sure.
Okay. Could you please confirm your first line of address for me?
Yeah, I'm living near 143 Lozels Road.
Okay. Nice to meet you, Mrs. Smith. Nice to talk with you, Mrs. Smith. Could you please tell me how can I help you?
Yeah, doctor, I'm not able to sleep these days properly.
Mm-hmm. Well, it must be troublesome for you. But could you please share your thoughts with me? So I would be in better position to help you.
Yes, doctor. Since like few weeks, I'm not able to sleep properly. I don't know. I don't
Hello.
have. Hello. Hello.
Okay. Yes. I can see. I can hear you. Yes, please.
Since few weeks, I'm not able to sleep properly. I don't know what's happening.
Okay. Well, we are here to help you out. Could you please tell me more about this? Like, you have a problem in going to the sleep, or what is actually problem? What actually bothering you?
Uh, I'm finding it difficult in going to sleep.
Hello.
Hello. I'm able to hear you, doctor.
Yeah,
Hello.
I'm not getting your voice clearly, but now I'm getting you. No problem.
Okay. I'm finding it difficulty in initiating sleep.
Okay. Is there any specific events that happen and then your sleep pattern has changed?
Yeah. My husband died a few weeks ago.
Okay. Well, I'm sorry to hear about your loss. As I said, we are here to help you.
Yeah.
So you have this problem after you lost your husband, right?
Yeah.
Okay. Okay. You said that you have a initiation of this problem with the sleep. Could you please tell me what actually you are doing just before going to the sleep?
Just before, like I have good, I don't drink alcohol. I don't watch TV before going to, no screens, nothing. Uh,
Mm-hmm.
yeah, no caffeine, nothing. Yeah, it's fine.
Mm-hmm.
Yeah.
Okay, okay. And that's very good. Anything else apart from this sleeping problem that is bothering you, Mrs. Smith?
No, just the sleeping problem.
Okay. Like any fever or flu-like symptoms?
No.
Any alteration in your bowel or bladder habits?
No, nothing like that.
Okay. How is your mood, Mrs. Smith?
Well, I'm not feeling very good. It's not,
Mhm.
it's not good since my husband died. I have been feeling low, a bit low.
Well, I can sense that this is a very troublesome for you to cope with everything. But as I mentioned, we are here to help you. Could you please score your mood for me? Like one is a very low mood and 10 is a worst mood you experience.
Well, it's around 6, 7.
Okay. Okay. Well, do you think that, sometimes some people at that particular time, like what you are experiencing, they try to harm themselves. Do you have any thoughts to harm yourself?
No, nothing like that. No.
Okay. Okay. Are you still enjoying the things which you were enjoying before the the problem started?
Not really. I'm not being very much social these days.
Okay. Yeah, this must be a trouble for you, but we can help you out and sorting out your problems. Is that okay with you, Mrs. Smith?
Yeah, sure.
Well, have you been diagnosed with any medical condition in the past?
No.
Okay, and to may I just confirm about your, a few questions regarding your personal health and lifestyle. Could you please confirm your diet for me? Tell me about your diet.
Well, I try to eat healthy.
Yeah, that's good. And what about the physical activity?
Well, I'm not being very active past few months. I used to
Mhm.
exercise, but I'm not able to exercise because I'm not able to sleep properly at night.
Okay, okay. Well, we'll sort it out these problems later in our conversations.
Yeah.
As you mentioned that you're not drinking alcohol and not smoking just before going to sleep. What about the other part of the day?
Smoking, yeah, sometimes I do smoke. Yeah, but no, I don't
Okay,
drink alcohol.
okay. Uh, could you please confirm to whom do you live with?
I used to live with my husband, but he has died, so I'm all alone.
Okay. Do you have any good friends or relatives nearby?
Yeah, I have friends, but they stay quite far away from the house.
Mm-hmm. But how is your relationship with other people surrounds you? And
Well, it's not, it's okay. Sometimes I do try to talk to them, but not every day.
okay.
Hmm.
What do you do for a living, Mrs. Smith?
I work in the nearby supermarket.
Okay, that's okay. Well, thank you, Mrs. Smith, for answering all my questions patiently. Well, at present, I just want to, make confirm that what you are actually going through. So we want to do some, assessment on you, like the clinical assessment, as well as run some blood tests. So I just, encourage you to come down to the, to the clinic if possible, so that we can evaluate your problem further.
Yeah.
Are you
Okay.
getting me?
Yeah. Sure.
Yeah. What else I can advise you on telephone? Like as you are feeling alone, lonely, just try to interact with the your friends or your nearby relatives, right?
Okay.
So that you can have have a good relaxation by talking with those people, right?
Okay.
We have some telephonic conversations, like I think some phone calls and some phone lines available in the UK. I will just get back to you which are the sites available for you, so that you can talk with those guys to get some help to rejuvenate by yourself, right?
Okay.
As you are not going out for frequently, I just encourage you at least try to come out from your home. At least try to walk in a garden, nearby garden. Try to enjoy running, jogging, talking with other peoples, so that you will get a new pleasures, right? Means you are out from your mood, and you will have a good mood.
Yeah,
Are you with me, Mrs. Smith?
yeah, doctor.
Okay. Okay. As you are taking balanced diet, I just encourage you to please continue with your balanced diet.
Okay,
Okay.
okay,
As you're smoking occasionally, well, I just encourage you to try to stop smoke, because
okay,
smoking all over is not helpful for the healthy health. Are you with me,
okay.
Mrs. Smith?
Yeah, doctor. Yeah,
Yeah. So would you like to come to the clinic for the further evaluation?
yeah, sure. I'll be there.
Well, thank you, Mrs. Smith, for your cooperation. Is there anything else I can help you on in these conversations?
Well, will you prescribe me sleeping pills, doctor?
Well, I can see that I can sense that you are concerned about sleeping and sleeping pills. Uh,
I'm
well,
sorry,
actually, we want.
time is up. Sorry.
Okay, no issues.
Yeah. Okay. So you can tell me how did you do?
Uh, well, I can see that one of the options for someone who is not getting sleep is sleeping pills. But lifestyle modifications like doing some exercise, engage with other peoples, and do some other things. That way you will get a good sleep. If you are not able to get sleep in that way, then we can go ahead with sleeping pills. But sleeping pills, they do have some advantages, ever disadvantages. Like, so
Yeah, yeah,
this way I can converse
yeah,
if
sure.
I will have time. If I will have
Yeah,
time.
yeah. That's nice. Okay, that's good. Um, in the history part, you can okay. Let's start with the history. Um,
Okay.
okay, you did good. Asked about like what's about insomnia and all. It was good.
Mm-hmm.
Initiating sleep, and always like you were asking two questions in one sentence. So I would say that
Oh yes.
yeah, just ask one question at a time, because the patient will only answer one of your questions, so he will miss one. So
Sure.
yeah, so that's an important thing. Apart from that, yeah, you asked would like, is it more in initiating sleep or what is it like?
Mm-hmm.
Also, I would say that because the patient said that she is unable to sleep for a few weeks, obviously
Mm-hmm.
it would be affecting her daily activities. I mean, if a person is not able to sleep properly in daytime,
Okay.
so you can ask initially,
Mm-hmm.
just to build the rapport, you can ask how is it affecting your daily activities, and
Mm-hmm.
all these things. So it just builds a rapport initially, so it will
Mm-hmm.
help you in your further consultation. The patient will also be keen to
Mm-hmm.
respond to all your questions, and they will also help you in answering
Mm-hmm.
all these things. Yeah. Also I think the reason why I came up with the sleeping pills thing in the last, because I think you forgot to ask about the eyes, which is the concern.
Oh
What is your,
yes.
apart from sleeping problem, what's your main worry? What is concerning you? What's your main concern? So if you had asked
Mm-hmm.
earlier, I would have the patient would have brought up quite earlier about the sleeping pills problem. Okay, it's fine. And yeah, you ruled out the differentials. It was okay. It was fine. Mood also, you asked about the mood. That was also good.
Mm-hmm.
Uh,
Mm-hmm.
yeah, flaws and all these things. Yeah, but all those things were fine. Nothing much. Also, you can ask you can ask in the past medical history, like, has this ever happened to you before? Just to say that.
Okay.
Okay, and in management, number one, like I said previously, it's always very important to give the patient a diagnosis. We have to
Mm-hmm.
say it. Like, as you said that as you said that your husband died few weeks ago, and after that you started having these symptoms. So Mrs. Smith, I suspect that you are having a condition called anxiety related
Anxiety
depression, which is
and
affecting your
insomnia.
sleep. Uh,
Mm-hmm.
but
Mm-hmm.
we would like to do further evaluation and investigations. For that, I would like you to come to the GP clinic, and then you have to say, would you like to know what all investigations we would like to do? Because it's important for us to lay down all the investigations, the say it, all the investigations that we would be doing, because obviously we are the number one thing is, the patient would like to know, and number two is we are getting 4 marks for the management. So it's important for us to tell all the investigations that we would be doing. So in this way, you can ask, okay, is it, would you like to know what all investigations we would be running through when you come into the clinic? She would say yes or no, whatever. If she says yes, you can say, okay, we'll run some blood test and also some routine, this blood test, full blood count, thyroid test, and all these things. And also, you can, and in the management, you can say that, well, there are, we initially we try to address this problem through lifestyle changes, and as you said, going out and talking with friends and relatives and all these things.
Mm-hmm.
Yeah, so that's how we can do.
Sure, I will modify the management. Thank you very much for your time and for your
Yeah.
feedback.
Yeah, thanks. And also, you can save, if you have time, you can safety net for depression and suicide. Safety netting, like if you think that the symptoms persist even after your, if even after you modify your lifestyle and sleep hygiene, you can come right away. Insomnia is also due to low mood or depression, and we need to safety net for the suicidal thoughts as well. Yeah. Okay, anyone has any questions related to this station? Okay, so just a recap about the management. How will you say the management in 2 minutes? So we will start with the diagnosis. Always give the diagnosis. I say, like I said, from we always give the we cannot say in 8 minutes we cannot diagnose a certain a disease. So we always give a kind of provisional diagnosis. So we always say that from our assessment and from what you have told, we suspect, in this way, we suspect you are having this condition. Do you know about it? The patient would say yes or no, and then we continue, okay, explaining the condition in a very simple layman terms. After that, we will ask, we will say that, okay, we will run some blood tests, and we will name it in this way, some routine blood test, full blood count, whatever it is, and some special blood test for that particular disease or condition. After that, we will lay out, always try to say the management, in use few words, but it should have a lot of meaning. Like, in this station, you can say that, okay, Mrs. Smith, there are lots of things which we can do here, and but as you are having sleeping problem, just for few weeks, we will try to address it with some lifestyle changes. Would you like to know about it? And then the patient would say yes, and you can address one by one, one at a time. Always at the end, safety net the patient. So in this way, you complete the management part. Okay, so anyone else having any questions? Okay. Okay, no questions. Patient concern. Okay. Many doctors ask, like, when we can ask about the eyes, ideas, concerns, expectations. Where, well, there is no particular way we can do, but mostly what I do is, just after ruling out differentials, just after asking differentials, I ask, what is your main concern? Just ask in this way, just simply, what is your main worry, what is your main concern? And the patient would say, and whenever the patient is having a condition for a few weeks, or for a couple of like months, the patient is having, always ask about his idea, like, Mr. X, I know it's been going on for quite a while. I'm sure you would have given some thought as to what would be the cause, what would be the cause for it. So always ask about this, so you will get some kind of feedback from the patient. The patient will say something. So it's good IPS points.
Can I ask one question?
Yeah, sure.
As in the task, it's mentioned that the patient is calling. So is there any difference between the telephonic conversation when we as a doctor has to call, and if the patient is calling? So at this case, is it okay to ask that is it the right time to talk to you? Because obviously the patient is calling, so it must be the right time for him. Or is there any difference between the two? cases?
Yeah,
Please
yeah,
tell
yeah.
me.
There is obviously, if the patient is calling, obviously it's the right time, for the patient. So we avoid asking this question to the patient. Yeah, and whenever we are calling as a doctor, obviously we will ask the patient. But rest of the things like confirming the patient's age, name and age and address, it's the same for for both the stations.
Okay, thank you.
Yeah, welcome. Well, in this case, where the patient's concern was sleeping pills, so we obviously, because the patient did not the patient is having insomnia just for few weeks, so we do not prescribe sleeping pills just right away. So whenever we refuse a certain thing, whenever we refuse investigation or a kind of medication to the patient when the patient is requesting, we always come up with a solution. We never say no directly. When a patient says, doctor, will you prescribe sleeping pills for me, we will not say no directly. We will say, okay, Mrs. Smith, I can see your valid concern. Always also you can ask, may I ask why would you like to have sleeping pills? Because it is possible to know why she wants sleeping pills. She will say something, her friend had the same problem and the doctor prescribed, or she read somewhere. So it's very important to get into the what the patient is thinking. So whenever patient says certain thing like, okay, will you prescribe sleeping pill for me, so we will always ask, why Mrs. Smith, do you think that sleeping pill would help you? Why would you like to have sleeping pills? And then the patient would say, whatever they want to say, and then we will say, okay, Mrs. Smith, I can see where are you coming from, and then you can address whatever she says in this way. What we can say if we could not find the cause for the sleeping problem? Okay. uh, okay, let me first tell you about the sleeping pills, and then I'll get back to your question. Okay, so where was I, like, yeah. So whenever the patient is requesting something, we do not just right away say no. So we will always say that, okay, Mrs. Smith, where are you, I can understand where you are coming from, and uh, sleeping pills only help when we have tried all the lifestyle changes, modifications, and sleep hygiene patterns, and only then it will be helpful. And always the sleeping pills comes with side effects, so it has a lot of side effects, and we don't want anything like that for you. So in this way you can address, and obviously the patient would understand. And if they don't understand, we just continue to address it. Just because the patient is demanding, we cannot just prescribe the sleeping pill. We always try to make them understand why is it not best for them. In this way we can address that issue. Okay, so one of the doctors is asking what we can say if we couldn't find the cause for the sleep. You have to be very open, and you have to be very honest with regards to that. You have to say that, okay, I will talk to my senior and we will run some investigations, and we will also we will try to get to the bottom of what's really happening. But what I can say, Mr. X, is at this point of time, unfortunately, I'm not getting what exactly is happening with you. So we have to be very honest with that. If we are not able to find it out, just say it to the patient, just like, I'm really sorry, unfortunately I'm not able to find it out, and I will talk to the senior, and he will come in, and we will be able to sort it out for you. Yes, along with DESA, we should explore caffeine. Yes, you are right. But I think I did say that I don't drink coffee before going to bed. Yes, you are right. Along with DESA, we have to explore the caffeine. Also in insomnia. Also, let me tell you like the specific questions for the insomnia. We say that, how is it, first of all, for the sleep, we ask, is it more in initiating the sleep? Do you wake up in the middle of the night, or is it that you wake up early? So these are the three questions, specific questions for insomnia. I hope you guys are following. uh, So we will get 0, 1 in the management section of this along the diagnosis. I'm sorry, I didn't got your question.
Doctor, as you said that there is 1 point, yeah, 1 mark to say the diagnosis in the management pen, and if we are not sure, and we will say that we are not sure at the moment, and we will talk to our senior. So from those 4 points, will we get 0? Like not all together 0, but 0 from the 1 point they are giving if we are talking the diagnosis.
No. No. There is not 1 mark for the diagnosis, but obviously, I mean, your whole management will depend on the diagnosis, and obviously, we have to give the diagnosis, so it does come under that section of management. So, giving the diagnosis is very important because uh, because the exam first of all, the examiner wants to know what you are thinking and how you will be presenting, and obviously the patient also wants to know what exactly is going on with with him. So yes. I hope it's clear. Hello. Okay. So how do they score 4 in management? It's disclosing, symptomatic management, safety net, and follow up. Yeah, exactly. The management, it first of all giving them a diagnosis, then telling them all the investigations that you'll be running, and then the management part, like the treatment part, either it's lifestyle or medications, and also you'll be saying that if you will be referring to a specialist or not, and then the follow up or a safety netting and follow up. So all these things, if you do it in a right way, you'll end up getting 4 marks in management. Yeah, and also they are not expecting that you say each and every line, each and everything to the patient. It has to be, catered to the according to the patient's need, what the patient wants to hear in management. There is like supposedly if you get a case of insomnia, there is like a whole list of lifestyle changes that you have, but we cannot talk about the whole list, obviously. That's when the data gathering comes in. You gather the data just to know that where the problem is, and you bring that problem in the management. you know so we don't recite, we don't talk the whole, we don't say the whole list, but we pick up the points which are there, which are missing in that thing. So we try to address all those issues. You manage the situation, not the condition, as Dr. Ramon Arora says. Yes, he's right. Yes, obviously, we have to manage the situation, not only the condition. That's what I'm saying. That's when the data gathering part comes in. You ask relevant questions. You ask about the eyes. You ask where the things are wrong, and then you bring that up in management and address it accordingly. Okay, so any other questions you have? Okay, anyone else who would like to do a mock, or it's fine?
Can I do?
Yeah, sure. Okay, just a second. Okay, doctor, are you able to see the screen?
Yes, doctor. Just a minute.
Yeah, sure. Just let me know whenever you're ready, and I'll start the timer.
Okay, doctor, let's just start.
Okay, sure. You can start now. Okay, you can start.
Hello.
Hello.
I'm Dr. Tehreem, one of the junior doctors in this department. Could I please confirm your age and name?
Well, my name is Nicole Jolie. I am 48 years old.
Okay, so what would you like me to call you?
You can call me Nicole. It's fine.
Nice to meet you. Tell me, how can I help you today?
Well, doctor, I found, one of the contraceptive pills in my daughter's room, and I just want to know who prescribed these pills for her.
Okay. Doctor, can you hear me?
Yeah. Hello. 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 Hello.
We can hear you, doctor.
Hello. Where is the doctor who was practicing? Hello. I am able to hear you.
We can hear you, doctor.
Yeah, but the other doctor, I think she left. She left. Okay, it's fine. Okay, anyone else would like to? Or you can also ask any questions if you have. Yeah, sure, you can. Hello.
Hello, doctor.
Yeah. What's your name? Sorry.
I'm Jasmine Modi. I just need
Okay.
a station with you. So if you
Okay.
permit me, then I will go ahead with the stations. Otherwise, if anyone else wants to do the stations, then I have no problem.
Okay. If anyone else who would like to do a station, they can do, or else we'll continue with you. If anyone else who is willing to do a station.
Sir, can I do it?
Okay, sure. Yes.
Thank you. Sir, can you show me this time, please?
Yeah, sure. May I ask your name, please?
I'm Dr. Siddiqui.
Okay. Yeah, sure. I'll just share the screen. Just a second. I hope you are able to see now.
Yes, doctor.
Okay. Let me know when you finish reading and you are ready. I'll start the timer.
Yes, doctor, I'm ready.
Okay, you can start.
Hello.
Hello.
I am Dr. Siddiqui, one of the doctors in GP clinic. May I know your name and date of birth, please?
I'm Nicole Jolie and I'm 48 years old.
Nice to meet you, Mrs. Nicole. And how would you like you to call me?
You can call me Nicole. It's fine.
All right. So, Nicole, how can I help you today?
Well, I have found, a contraceptive pills in my daughter's room, and I want to know who prescribed these pills for her.
Okay, all right. May I know how old your daughter is?
She's 15 years old.
She's 15 years. And is she also registered here in our GP clinic?
Yeah. My whole family, they have been registered here.
All right. So you found contraceptive pills in her drawer?
Yeah. In her bag, yes.
in her bag. So what is your concern, Nicole?
I just want to know that who prescribed these pills for her.
All right. And why you think that you want to know who prescribed this?
Because I want to know that without, without asking the parents, how can they prescribe contraceptive pills to my daughter?
All right. So Nicole, did you speak to your daughter about it?
No, I did try to speak and we argued and she left the house.
Okay. So Nicole, your daughter, as you have told me, may I know your her name as well?
Yeah, her name is Diana.
Okay, Adina. And Nicole, the thing is, since she is 15, and I do not know what actually happened, but if she has the pills, I'm assuming that she came to the clinic, and since she's 15, so she can ask for contraceptive pills.
Okay, that's fine, but I just want to know who prescribed these pills to her. I just want to know why and how did did anyone prescribe the pills?
Yes, I understand your concern since you are a mother, but since Diana is 15 and she came to the clinic, and I'm sure one of my colleagues must have discussed with her, and they thought that she is competent enough to understand the situation and she's responsible for her actions. So they prescribed her the pill, and I cannot give you information regarding that.
Okay, but just can you just tell me if the GP gave her these pills? Just if you can just let me know if the GP gave this.
Yes, Nicole, I understand since you're a mother and you really want to know, but I think it would be a better approach that if you speak to her directly in a calm and friendly way, and maybe you can discuss the situation with her, and you can also know who she's dating, and her boyfriend, is he in her class? So these are the things that you need to discuss with her. But I assure you that if one of my colleagues prescribed her the pills, then it must be because uh, for in the best of her interest.
Okay, so you are encouraging them to have sex.
Yes, Nicole, I'm not encouraging them to have sex. I'm not saying that, but in our system in NHS, if a boy and a girl, they are 15 and they are mentally competent to make their own decisions and choices, they can ask for contraceptive pills. They have every right to ask for that.
Okay, so but just doctor, if you can tell me who prescribed these pills for her, I just want to know that, and that's it.
Okay, Nicole, do you think it would be what do you say if I can arrange an appointment for you with your daughter, and you, your daughter, and the gynecologist prescribe those pills, my colleague, and I can sit with you and we can have a chat. What do you say, Nicole?
Okay.
How does
I'm
that
sorry,
sound?
doctor, we can't hear anything. There's a lot of background noise. I'm sorry to interrupt.
Yeah.
Yes, I am also having issues with it. Someone's. This is not from my side, but someone else.
Okay, if anyone can, they can mute them, please. If you could mute yourself, I don't. Okay, now it's gone. Okay.
Thank you, everyone. Okay, so Nicole, how about this? I can make an appointment with you, your daughter Diana, and my colleague, and we can have a discussion about it. How does that sound?
Okay, but I don't think so. She would be happy she would like to come into the GP clinic.
Yes. Okay. So, uh, if you want, I can discuss with her, and I can ask her to come and discuss it. But again, I'm telling you, Nicole, that if a girl and boy, they're 15 and they are in a relationship, they have every right to ask for contraceptives and they can use it. And we are not allowed to break their confidentiality and involve the parents if they ask us not to involve their parents.
Okay, but I am, I'm just concerned. She's my daughter, and I just want the best for her. So I just want to know. I mean, I don't know why is it so difficult. If you can just let me know who started.
Yes, Nicole. I, uh, I can see that you are very concerned about it, and it's yes, you are right. You're a mother, but this issue you need to discuss with her directly. And I'm sorry, but I cannot give you her confidential details.
Okay, but what if she is in some kind of abusive relationship?
Yes, for that, I'm sure my colleague, when they prescribed her the contraceptives, they might have taken the complete history. And I assure you, if any of us feel that that the younger person is at risk of any abuse, or if they are having a relationship that is from someone that is not from their age group, so we never prescribe them contraceptives, and we always involve social services, and we always inform the parents. But if one of my colleague have prescribed the medication, I'm sure that she must have taken the complete history, and after being confident that she is in a relationship with someone from her age group and she's not being abused, so that would be probably the scenario.
Okay, doctor. Okay, that's fine. Okay. Okay, the time's up.
Thank you. Thank you, sir.
Okay, so you can tell how did you do? How was it?
Sir, I have never read this scenario before. It was a very new thing for me.
Okay, that's good.
I
Still, you did.
so that's
In that case, you still did quite better.
yes, I'm sure I must have missed a lot of points. I think I wasn't able I wasn't able to make her convinced that I cannot give her my, because she was constantly asking for my colleague detail, and this was one thing I was having difficulty. I actually I didn't have any idea how, what should I say if someone is asking me for my colleague who prescribed the medication, and in my opinion, whatever my colleague did, it was absolutely right, but she wanted to know. So this was the best I can do, that I can assure her that my colleague was right, and you should ask your daughter politely, and this is what I think.
Yes, you are
But
absolutely.
I'm open for any feedback. I'm open for all the any feedback,
Yeah,
even
sure.
from the participants as well. That would be very helpful.
Yeah, sure. So, number one thing, you mentioned that you were not able to convince the patient because she was constantly asking. Well, number one thing is in exam, they don't expect us to convince them, but what they are looking for us is their approach. How we is our approach correct? Because it's not our job to convince them. It's our job to lay down all the multiple options and give them options, and they can choose whatever they wish. So. It's obviously it's if the patient is not convinced, so don't worry, it's because it's not our job to convince them. Obviously we like obviously we will try to convince them, but if the patient doesn't agree to what we say, so you don't think that you have failed that station. It's not like that. Yeah.
Yes, sir.
And yeah, so number one thing, let's start with the history. Like it's fine. The history was okay. Okay, you could have gathered a lot. Ask a few questions like when the patient said that she found contraceptive pills in the bag. So you can ask when did it happen, and also is it possible that those pills could be of her friend? It could be that it's not hers, or it's someone else's. So we can ask, are you sure that the pills are hers and not any of her friends? So
Yes,
we
sir.
can.
And I asked that, and the patient, sorry, the mother said that she asked her daughter, and she had an argument, and she left.
Yeah. So, well, the argument can be okay, anything. Okay, it's fine. Okay, you can say that, okay, have you talked to her and what did she say? In the argument, like, okay,
Yes.
what did she say? And do you know where she is now? Okay, and do you have any idea if she's in a relationship? It's very important to ask the mother if she knows. And also, it's important, who do you live with at home apart from Diana? So that's also, I think, an important question. I think this is the data gathering. These are the questions which you can ask, and after that you can switch over to the management. Obviously, it's a confidentiality station. We do not reveal the thing, who prescribed the pills. We cannot even say that my colleague prescribed or my colleague did the right thing. What we can instead, when the mother is asking, doctor, can you please tell me if the GP gave her these pills? What's the best answer we can give? So we can say in this way: I understand that you are concerned about about your daughter, but I am really sorry. We are obligated as medical professionals to keep the medical records of our patients confidential as long as they are competent. So because she's 15, she's competent, we cannot reveal. We are obligated as medical professionals to keep the records of our patients confidential. So we cannot even reveal who prescribed, and if our colleague prescribed it or not, we do not know, and we cannot reveal this thing to you. I'm really sorry. Also, you can constantly appreciate the mother for being concerned, and just being like, you can say, okay, I appreciate that you're concerned about your daughter. I appreciate that how you think about your daughter, how caring you are, how caring mother you are. So with these questions you can, these sentences you can use. But followed by these sentences, you can also always say, but I am sorry, I cannot give you any information regarding that without her consent. Without her consent, we cannot give. But what we can do is, we can explain her that whenever we have a girl in Diana's age come for contraception, we we always advise them to bring their parents. If they refuse, we still have to see them and give them all the information they need, because we have to prevent unwanted pregnancies. So these are the things you can say to the mother. And these are like some of the good sentences you can use.
Yes,
And
sir.
also,
Thank you, sir.
yeah, and also you can say, before prescribing the pills, we make sure that she understands the risk of being involved in a sexual relationship and taking contraception. So all these things we say. Also, when the patient says that you are encouraging them to have sex, so in that context, we can address this question in this way, like, I'm really sorry for the way you are feeling, but it's legal in UK for someone of Diana's age to have sex with a partner in the same age.
Yes,
So
sir.
yeah, I hope that's clear to you and other doctors here.
Thank you, sir. It was a very important station.
Yeah, it is, because it's the confidentiality station, and also, like, there are various issues which we have to address in this one.
Yes, sir.
Yeah.
Sir, but if the patient is constantly asking about the colleague, but you never reveal the name of the colleague, right? You
Yes.
never say that.
Yes.
Yes. Okay.
Also, we do not say that whether she was prescribed contraceptive pills from this GP, and whether anyone else prescribed. We cannot say anything. Just it's the whole thing about this station is confidentiality, and addressing the confidentiality, like why we are why we are preventing such information, like we are preventing to give some such information. Also, we can say that if we uh, if we give information about our patients to their parents, they would lose trust in us as medical professionals, and they may have sex without our advice which may result in bad consequences like unwanted pregnancies and sexually transmitted disease. So we do not want anything like that to happen. That's why we are obliged as medical professionals to be to stay confidential.
Yes, sir.
Yeah, so these are the various things which you can say in management. Yeah. Okay. Yeah, it's 13 age. Yeah, it's the same as 13. Yeah. Any other doctors who have any questions regarding this station? Because I think it's an important scenario and lots of things are here. Yeah. I think Dr. Tehrim, she's back. She left the station in between. Yeah, I hope you were able to listen to the discussions.
Yes, I'm really sorry, sir. My net got
Fine.
disconnected,
Yeah, it's okay.
and I just
Yeah,
joined
it's
back.
back. Yeah, it's fine. Okay, so anyone has any, okay, at what's the data gathering here? Okay, one of the doctors is asking, okay, here the data gathering is, okay, you can note down the questions I'll be saying. Um, First of all, we will ask the age of the daughter. What's the age, because it's very important. After that, we have to ask, do you mind if I ask some questions to be in a better place to address your concerns? And these are the specific questions which you have to ask. When did it happen? When did you find the contraceptive pills from your daughter? When did it happen? Are you sure that the pills are not hers, are hers and not any of her friends? Are you sure of that? And have you tried talking to her? And what did she say? And do you have any idea if she is in a relationship? And whom do you live with? And at home apart from Diana. So these are the questions which we have to ask in this station. It's a whole kind of ethical counseling station. It's a mixture of that, because here there is ethical part, which is confidentiality, and counseling, because we have to counsel the mother and we have to make her understand why it's why the confidentiality is important, why we refuse to reveal the information. So it's a kind of mixture of ethical as well as counseling station. Do we offer support to mom? No, we don't offer any kind of support to the mom. But at the end, at the very end, when we have given her all the options, we have explained her everything. At the end, if we have time, you can say that, okay, we can arrange, if it's possible, you can bring your daughter with you, and we can arrange an appointment with you, with you and your daughter. So we can do that. Otherwise, there's no we do not offer any kind of support to the mother. Okay, one of the doctors is asking, age, may I ask you some questions? When did it happen? Are you sure pills okay? Yeah, this is the data gathering. Yeah. Okay. Okay, any other questions you have with this? Okay. Also, I hope you guys are liking the flashcards that I'm making. I don't know if it's helpful, and if it is benefiting you. I don't know. Let me know if if you're finding any station difficult. I can make some flashcards for that as well, because yeah. Thank you. Okay, I'll be sharing all these flashcards in our Telegram group, so you can have access from there. You can use from there. Okay, you can join our Telegram group, and I'll be sharing our Telegram or WhatsApp group. I think WhatsApp group is full, so you can join the Telegram group. Okay, could you share some tips to remember the milestones? Okay. Okay, I'll share the Telegram link as well. Okay, Telegram link. Okay. Milestones. Okay, I'll make one on the milestone as well. One flashcard on that. I'll remember that as well. Okay, and one on ethics stations as well. Sure. No examination in tele. Yes, no examination in telephonic stations. Yes, but what we can say is, okay, Mr. X, when you come into the clinic, we will examine you and check your observations. You can say it in this way, but obviously we do not say that, okay, I would like to examine you, obviously, because on the telephone we cannot say that. But you can say it in this way: okay, Mr. X, when you come into the clinic, we will examine you, check your observations, do whatever specific examination related to that station. In that way you can say. Okay, mother asking sick note, chicken pox child. What was that? Sorry. Can we have a case note on that? Okay, sure. I'll try to arrange another session on that as well. Sick note. I think sick note is one of the very difficult, kind of complex topic. So I'll try to arrange a session for that as well. I'll remember that. Okay. Sure. Sick note. Well, one thing I can say about sick note is we provide sick note only to the patient, not to the carer. If in this case where the child is having chicken pox, we cannot give sick note to the mother, because mother is not suffering from chicken pox. It's the child who is suffering from chicken pox. So in such case, what this case is, I think there is an aspire where mother is not having any symptoms of chicken pox, but the child is having. So we try to give her various options, like try talking to the employer and try to arrange some leaves or anything like that, if anyone at home can take care of your child, or something like that. Yeah. Is it a same pattern in telephonic and video call stations to follow? Yes, it's the same, but in video station you will say extra thing. Okay, are you able to see me, and are you able to hear me? That's I think important in case of video call stations. Otherwise you follow the same pattern as you follow in telephonic stations, which is confirming the name, age. Is it, if we are calling, ask if it's the right time to talk, and yes, confirm the address, and also say that if it's the best line to, if it's the best number to call you if the line disconnects. So yes, it's the same mostly, apart from this one question. What about the station where the patient has multiple medications and he wants to know about side effects? Do we open BNF? Okay. Okay. In such case, the patient is having multiple medications, so we have to ask, do you want to know side effects about any particular medication? We ask because it's not possible for us to to tell the side effects of all the medications he's having. But yes, do we open BNF? If the BNF is there, uh, you can open it. Yes, you can open, you can check it. Obviously opening a BNF, finding the drug, finding the side effect, it takes, I have seen, it takes nearly 1.5 minutes. It takes nearly 1 minute if you are, if you're not using it regularly. But what you can do is, I will tell you a trick. Obviously, you will be knowing the side effects of the medications, but what you can do is, you can tell the patient, okay, is it okay if I can have a look in the book to see the side effects? The patient would say, all right. You can just act, you can just open the BNF, flip over the pages and see what it is, and then okay, you can say that, okay, you are having these side effects because of these medications. Because I think it's in exam, you are always, you are already under stress. You will be flipping pages, you will be, difficulty finding the medication and the side effect page. So I think yes, you can open the BNF, but you can, just fake it. Yeah. Do we always do physical examination on all non-tele? Yes, obviously, yes. We do not perform the physical examination, but we verbalize it. We say it in this. We say it like, I would like to check your observations. I would like to do general physical examination, and any specific or any special examination. For instance, a patient is having hypothyroid symptoms, so you would say, okay, I would like to check your thyroid gland in the neck. Also, I would like to check your neck examination for the gland. So yes, in all non-telephonic stations, we uh, yeah, we do this. So do we memorize the side effects? Well, they do not give medicines which are difficult. They these are ACE inhibitors or salbutamol or propranolol, all these kinds of either diabetes medication or thyroid medication or hypertension. So the like very basic and very common medications they give. So it's you can memorize that. Yeah, one or two side effects which are specific to that class of drug. Okay, so I think yes, I think we'll wrap it up here, wrap the session here. If do we have any further questions or yeah. Okay, thank you, doctors, for joining in. It was, I hope you benefited from it. Yes, there will be other sessions, and I will keep you updated. And let me know what other kind of, like, apart from box, what other sessions you would like to have. There are certain important stations, or if you'd like to discuss some important stations, or if you'd like to discuss some IPS or anything like that, we can arrange a session for that as well. And I would be more than happy to arrange that for you. So yes, let me know, and I hope it was good. Combined station will be good. Okay, sure, I'll remember that. Okay, yeah, sure. Okay, thanks a lot for joining in, and I hope you pass the exam in your first attempt, because yeah, because of COVID, it's getting, the exam is getting a kind of a big deal. It's a big deal for us, because I have seen people, there were doctors with me who had exams before me, but because they couldn't make it, unfortunately, they're still struggling to get a seat. So I hope you all got, everyone here pass their exam, their first attempt. So yeah, I really hope that. So all the best to you, and yeah, see you soon. Yeah, sure. One question. Yeah, go ahead. Okay. Okay. Okay, in ear station, you won't be able to see the tympanic membrane. There will be, all the earwax will, when you exam, be able to see the tympanic membrane. There will be, a lot of earwax in the ear, and yeah. So the management is, I think, straightforward. We prescribe olive oil drops for a few weeks, and then ask the patient to come in. Also, we say, do's, there are certain do's and don'ts which you can find, like asking the patient not to use the swab sticks, because it will worsen the condition and all. So yeah, I think that's it. Yeah. Okay, then thank you very much for joining in, and hope you have a good Sunday. So see you next time. Bye bye.